Hello, what do we have today?
Okay, so today we have a patient who is a 45-year-old male who suffers from PTSD from combat, and he also served for 4 tours. So he presented for treatment approximately 1 year after honorable discharge from the Army, and he frequently has nightmares throughout the night, and he has trouble sleeping. He also reported having flashbacks that make him avoid large gatherings with loud noises. And then the patient also has a history of substance abuse.
Okay, thank you. I will go over and check up on the patient. Hi, I'm Tara. I'm going to be your nurse today. How are you feeling?
I'm feeling okay.
I heard that you had a bit of a rocky night last night. Would you like to tell me more about it?
Yeah, I've just been having trouble sleeping through the night and I keep having flashbacks.
The nurse from last shift told me that you have PTSD, but based on what they told me, I don't think you have PTSD. I think that maybe you should try some sleeping medication like melatonin. Can you describe your flashbacks to me? Is there any certain trigger that makes you experience these symptoms?
Yeah, they normally happen when there's loud sounds like banging.
Okay, that is a normal reaction for patients who experience PTSD from the military. I can arrange a therapist session so you can talk and see if there are anything that makes you less anxious and that can help with some of the symptoms.
Alright, yeah, I'd like to try that out.
Hey, how are you feeling today?
Honestly, not good. I keep having these nightmares. I can't sleep. Every loud sound seems to drive me crazy. I just can't take it.
Alright, I hear what you're saying. Do you feel like your symptoms are impacting like your daily life activities, like getting up in the morning, going to work? Do you feel like they're impacting activities like that?
Yeah, I don't like to go out to parties or large gatherings because I have a lot of anxiety and I've been unable to hold a job.
Have you tried like any different coping mechanisms, especially when it comes to your flashbacks and like getting back to sleep? Or have you tried anything to reduce your anxiety, like maybe meditation or exercise, anything like that to help?
Not really. I drink sometimes and smoke a little weed if I really need to. All the other deep breathing stuff doesn't work.
I think for you, one of the best coping mechanisms that we can really implement here is exercise. I think the next time you have a flashback or you're experiencing any of these, anxiety symptoms, I'd recommend taking like a brisk walk, maybe 15 minutes at most, just to clear your head, change of scenery, channeling that anxiety and those feelings into something kind of constructive and productive, even if it's just, a short walk or maybe, jumping jacks or something that gets your mind off of it, kind of changes your pace, I think would be really beneficial for you. I think it would also help if you use maybe some meditation, some mindfulness. If you have something regimented, maybe a YouTube video to listen to, I think that could be really helpful.
Okay, I guess I'll try it next
How do you
time.
think the therapy session went?
I think it went well. We talked about how I can use other methods like exercise to reduce my anxiety. I'm pretty eager to try it out because I know it will be a better way of dealing with my anxiety.
That's great. I recommend that you keep going to therapy because you'll be able to talk about stressful events and be able to figure out what is triggering them and find ways to reduce them from happening.
Okay, so PTSD can cause many symptoms to arise. So the best thing to do is know why the symptoms occur and and what you can do to treat them. So I recommend that you keep a journal of when you have symptoms and write why you think they occurred and what exactly happened. As a family member, you should watch out for the same symptoms and any triggers as well. I would try other behavioral adaptations as well, like relaxation techniques, like deep breathing, mental imagery, music, or art. So the goals that I've set for you are to be able to concentrate and make realistic goals for the future. So including your family and significant others in the process, verbalize no ideas of intent to cause self-harm, attend support group and therapy with people who have similar issues, and verbalize the desire to put the trauma in the past and progress with your life. Okay, so I would like to discuss with you and your family about your plan of care as well as identify some goals that we would like to work on. It's important for all of us to contribute and agree upon these short-term and long-term goals and plan of care for the best outcome.
I'm really worried about his sleeping patterns. I'm worried that he's not getting enough sleep every night and that he's going to fall asleep while driving.
I just want the flashbacks to stop. But I know still bother me and are a trigger for me, which causes issues when I'm in a public place and I don't have any control over it. The therapist told me about exercise and relaxation can help, but I'm not sure I'm able to do that on my own yet.
Okay, so the priority is to maintain your safety as well as the people around you. Some of my concerns regarding your mental health is becoming more comfortable talking about your fears and emotions.
Yeah, I find it hard to be supportive when he needs it, and I never know what he's thinking and feeling, so I can't be there for him.
Okay, so since we all agree on the things that need to be focused on, our short-term goals can include being able to verbalize your feelings and fears to the healthcare team during your hospitalization, and that you will be able to demonstrate your ability to deal with emotional reactions in an appropriate manner within the next week. You will be open-minded and be willing to try new coping skills effectively during your hospitalization. And how do these sound for short-term goals so far?
They sound good. I think those will be really good for me because they'll help me focus on the things I need to while I'm here.
Okay, great. So now to look at some long-term goals. You expressed that you were worried about his sleeping. So one long-term goal that can be that patient will sleep 7 to 8 hours a night for the next 6 months. Another long-term goal can be that the patient could attend social gatherings with loud noises. So that includes concerts and sporting events. And this will be able to maintain his anxiety by using these adaptive coping strategies that I talked about earlier. And a last goal can be that the patient is able to talk about the loss of his fellow soldiers using healthy coping skills for every encounter in the next 6 months. Do these work for you?
Yeah.
Hi, I'm just checking in. I know we covered a lot today, and I know it can be a bit overwhelming, but you have come a very long way today. How do you feel?
I'm okay. I know that it was a lot to take in, and I know that I want to change and be better. I just think I need some rest right now, though.
Okay, I'll be back to check in periodically, but if you need anything, feel free to come find me at the nurse's station.
Okay.